Nursing is hard, y'all. Nursing is really hard. I'm currently in a new state for some training, and I'm moving out of the nursing student phase. And as you guys know, I got my RN, so I'm moving into the nursing orientation phase and the training phase where I'm learning to do my job and to do more nursing things. And I would say the biggest difference between what I'm doing now and what I was doing before as a nursing student is now that I still have a preceptor. However, I get a little bit more independence as far as doing things on my own. If I understand how to do a certain task or skill, I'm able to do it by myself. And now I get my own patients. And it's not just one patient like in nursing school, it's several patients. So I get 3 to 4 patients throughout a shift, and I kind of work on those patients on my own. I have to consult the doctors or consult the multidisciplinary teams that we work with, so PT, OT, things like that, to make sure that our patients are getting the right consultations and make sure that they're getting the right help that they need. I think at first it's a bit overwhelming just because we are, at least at our nursing school, we weren't used to doing all of those things on our own and doing all of those things at once. And I think it's a lot to take on. Nursing is hard, y'all. Nursing is really hard. And I would say the biggest thing to do is just to not beat yourself up about it. If you don't know something, I think the biggest tip I can give you is don't be afraid to ask. I think asking is the biggest thing that you can do. Put your pride aside, and just because you don't know something doesn't mean you're a bad nurse. Just because you don't know something doesn't mean that you're not smart. It doesn't mean any of those things. It just means you don't know, and you don't know what you don't know. And in nursing, there's probably going to be a lot of things that you don't know. So don't be afraid to get out there. Ask a more experienced nurse, ask a nurse that's been on the floor for a longer amount of time, ask even a nurse that's sitting right next to you. Whoever's next to you, don't feel scared to ask them, because if you don't know, they might know. And the biggest thing about nursing is that you're all working as a team. Whether it's you with the docs, you with other nurses, you with whoever, you guys are all a team. And it's really important that you identify that, and it's really important that you rely on your team members. So I would say the biggest thing is asking questions and relying on the team members around you, because you and your team are what's going to help yourself, and it's also what's going to help your patients. So don't be afraid to ask questions and rely on your team. And again, there's no question that's not smart. There's no question that you shouldn't ask. If you feel like something's pertinent, don't feel scared to speak up about whatever lab value you see or whatever question that you have, because it could end up being something that could save somebody's life. So it's better if you speak up earlier rather than putting it off and being too scared to bring it up. Second thing, document everything. So anything that you do, anything that you see, document. Here at the hospital that I'm at, we document by exception. I'm sure at a lot of hospitals they're doing that. If you see something that's abnormal, then that's when you would write it down. However, a lot of the times I'll still document if things are normal as well, if I have some time. You want to make sure that you're documenting and writing everything down. Any interactions that you had with the patient, any interactions that you had with the doctor. If you informed a doctor and weren't able to speak with them, you want to write that down as well. You just want to make sure that you're documenting. Third thing, make sure that at the beginning of the shift and throughout the shift, you're always assessing lab values and you're always assessing vital signs. And that might seem like an obvious thing, because in nursing school, we were always assessing lab values, always assessing vital signs. But you want to make sure that you're catching trends, whether it's trending upward, trending downward. A lot of things that I've been seeing lately is blood pressures. So you want to make sure that you're catching that early, whether it's a small jump or a large jump. You want to make sure that you're like, okay, this is something that I might want to alert the doctor about. And same thing with lab values. You want to make sure that you're checking lab values that are pertinent to whatever the patient may have. So if it's sepsis or infection, you want to make sure you're checking the white blood cell count, making sure that it's trending downward every day, making sure you're not getting a new infection, making sure the antibiotics that you're providing or administering are working for the patient. If they take labs twice a day, then that's something that you want to inform the next nurse about. You want to inform them that, hey, this is not working, or this is working, or this is what I've seen. Again, no reason to be scared. If you over provide information, I don't think anybody's going to be mad at you. So don't be afraid to speak up and let them know what you see. Fourth thing, delegate. Make sure you're delegating at all times if you're able to, and it can be to anybody that's available. If they're willing to help, just ask the question like, hey, if you're not busy right now, would you be able to do vital signs for me? Or would you be able to do XYZ thing for me? Because I feel like that really helps with my next thing, which is time management. However, yeah, if it's possible, and if somebody's not doing something, or if somebody has a free hand, like, hey, would you mind walking in this room with me so that we could do this really quick? Hey, would you mind just grabbing some vital signs? I'm trying to get this medication to my patient. Whatever you're able to do, and whatever you can take time off of your hands and help that other patient do what they need to do, so you can help two patients at the same time. If somebody else is free and doesn't have anything going on, don't be afraid to ask those other people, because at the end of the day, you guys are working as a team, and teams, want to help each other out. And the better that you guys function as a team, the better care patients will receive. So don't be afraid to ask, which will help with your time management. Which brings me to number 5, time management. So time management is really hard as we kind of move away from the nursing student process and into the nursing phase. I would say that the hardest thing about time management is that, you're kind of just trying to make it flow. I think the best thing that you can do, and I'm sure everybody's learned this in nursing school, is plan. So before you go into a patient's room, make sure that you have everything so you're not walking out of the room 5 times. Make sure that you if you're grabbing a PRN med for that patient, make sure you grab all their scheduled meds as well, so you don't have to go back into that patient's room after you've, got them settled down, have everything done for them. And kind of you want to try to have a basis for your day. So you want to prioritize, have a basis for your day. And obviously every day is not going to go as planned, but you want it to go as smoothly as possible. And if you create a plan for your day, that'll kind of happen. That's kind of what I have. Those are my 5 tips. If you guys have any questions, comments, or concerns, feel free to leave them down below. And thank you guys for watching. The next time you guys see me, I'll be in a new state. So looking forward to that, and looking forward to showing you guys the moving process. We're going to be driving from where I'm at now to our next location. So see you guys there. Bye.